This video is just one part of a full series released right here week after week. Subscribe below and hit that bell to make sure you don't miss an episode. Enjoy. Nearly 40% of people with borderline personality disorder have previously been misdiagnosed with bipolar disorder. Sammy is one of those people. You were misdiagnosed.
Yes.
This is common.
Very common. A lot of people apparently that have BPD were diagnosed with bipolar at one point.
So when you're in that room and the psychiatrist tells you have bipolar disorder, what did you think?
I, at first, was like at ease, I guess. I was like, okay, hopefully this is correct.
Did you know what it was?
Well, my mom had it, so I kind of knew what it was, but I wasn't like, obviously I didn't do any research or anything, but it still didn't make sense. It still didn't like really click for me, because I wasn't just like an angry person. I wasn't just having this mania. There was so much other things that were factors in it. So I was kind of confused for a while and just I just didn't know what to do. So I was like, okay, well, I'm trusting this doctor to hopefully give me the right treatment and hopefully this works. Yeah. So.
How many sessions did it take for you to get the diagnosis?
2. They gave me 2.
How long were they?
An hour.
So in 2 hours, this doctor gives you the bipolar disorder diagnosis. And then what type of treatment do you start?
So instead of saying I should probably start therapy first, they said they wanted to put me on medication. So for me, I was like, okay, I know my mom's been on medication. Hopefully this will work. So I was all for it. I've always been pro medication if you need it. So I was like, okay, like let's try it. And they put me on a few different ones and my body just rejected them completely.
Do you remember what they were?
I've been on over 20 medications my whole
thing.
No. No. But yeah, it was like 2 or 3 they started me on, which is so much. I feel like, especially if you're just diagnosed with something. In my opinion, and after talking to many psychiatrists, they've told me, you don't usually start with 3 medications. You start with 1, you see how that goes. If you need to factor in a different one, you kind of just see how it goes. And she started me with 3 right off the bat. And I was sick, like so sick from it. And then eventually it made me not want to be on medication. So it was just like this weird cycle that I was on.
When you say you're sick, you were nauseous?
Physically sick. So I was nauseous. I was having migraines. I was in bed, I couldn't get out of bed. It was terrible. Yeah.
How long were you on the medication?
They made me try them for 2 to 3 weeks. But after a while, I was just like, I'm too sick. Like, I can't do this. So I would stop. And then they would get upset with me because they're like, you're not supposed to just stop, blah, blah, blah. And I'm like, no one's listening to me. Like, I can't live like this. At the time I was working full time and going to school. I was like, this is just, I can't,
Who's they? You're saying they?
The doctors.
So you have more than one?
So I eventually went to a therapist and then had my psychiatrist. Yeah.
So you're working in conjunction with the medication from the psychiatrist, the talk therapy from the therapist.
Yes.
Treating bipolar disorder.
Yes.
Which you don't have.
Right.
Did your mood or behavior improve?
No.
No.
No, not at all.
Did it get worse?
I would say it got worse. Yeah. I would say I'm very impulsive, and that's a huge thing with BPD. I would spend a lot of money. I was very promiscuous. There's a lot of things that factor into that.
That's all bipolar symptoms too.
Right. That's true. I was self-harming. And I don't know, my moods would fluctuate so often. Within the hour, I could be so angry, and then I would be emotional, and then I'd be totally fine. And it was like, I'm fine, whatever. And it was just so inconsistent, and it was so exhausting that I knew there was something else wrong. And I would get so offended by little things that normal people don't get. Like, it's like life or death, I guess. It's so extreme and intense. I don't know. That's how I can explain it. But
did you ever hear from your therapist or your psychiatrist the phrase borderline personality disorder?
No, not at all.
They didn't even say it could be that, it might be that.
No.
They just told you it is bipolar disorder.
Yep.
Did you ask them any questions?
I don't remember, honestly. Probably not. I just tried to trust them. And I think that because my mom had it, I was so like, okay, well, my mom had it. That makes sense, I guess. You know, that could be it. I don't, you know. So I just kind of trusted them for what they were telling me. And then, you know, I don't know. It was just terrible.
How long were you in treatment?
I was in treatment for about 1.5 years. And then
taking the medicine too?
Yeah. So I finally got on a medication that was working for me.
Not making you sick.
Right, exactly. I was still dealing with symptoms, and I was just very inconsistent with things that I was doing. So eventually I just quit treatment altogether. And I was just like, it's not working. Nothing's working. I'm stopping everything. So I stopped going to the therapist. I stopped seeing my psychiatrist. I stopped taking my medication. And for a couple years, I was just on nothing.
I'm not shaking my head at you, okay? I'm shaking my head like this to you. I'm shaking my head no, because this is the main problem with this current system. You go on the internet or you go to your primary care and you search for a doctor.
Yep.
And then you go to that doctor and you don't even know if you're allowed to ask them questions.
Right.
And if you do realize that, you don't know what questions to ask.
Exactly.
And then you get a diagnosis. You don't get educated on what that is.
Nope.
You get fed pills, which can make you sick. And then you treat something that you don't have for 1.5 years.
Exactly.
This is why the education, this is why I get so pumped up of what we do here at MedCircle, because that education makes all the difference.
It's so important.
If you would have seen that video when you were 19 about the 9 traits of borderline personality disorder, you could take that to your psychiatrist and go, I think it's this, but you could confirm.
So quick.
Yeah.
So quick. Yeah. Yep.
That education is so crucial. What was life like for that 1.5 years?
It was inconsistent and just a mess. I was juggling working full time and going to school. I was a dental assistant, so I went to dental assisting school, and I was raising my sisters still. They were in junior high and high school, so I was like taking them to school and taking them to practice and like trying to juggle everything. And I was still at that time an addict, so I was still doing drugs and trying to juggle all these things and trying to get treatment. But I didn't realize at the time that like I need to put all of my effort into seeking treatment and not, you know, trying to depend on drugs and alcohol and stuff. So I wasn't quite there yet. And then eventually I was just like done. So.
Before we get to your done point, did your therapist and psychiatrist know you were using recreational drugs?
No, I don't think so. No.
Okay.
Yeah.
When you came to them and you told them, guys, this isn't getting better, what was their response?
They just said, you have to continue to take your medication. You have to continue to go to therapy. That was the answer that they gave me. Yeah. And it was just, and I was so angry because I was just like, do you even know what you're talking about? You know what I mean? Like, do you even know what you're doing? Because it doesn't seem that way, because I'm not getting better. And like, I had seen this pattern with my mom, and I was just like, I'm not going to be my mom. Like, I need to get this treatment. I need to get help, you know? So it was kind of like a traumatic life or death type situation where I was just like, I don't know what to do. And then eventually I gave up on it.
I get why you gave up. Why would you keep going with something that isn't working?
Right.
Yeah.
Exactly.
It's why I think a lot of people try treatment and don't like it and then leave because they didn't have the education going in to make it work for them.
Exactly.
It's like showing up at a gym, but you don't know how to use one piece of equipment.
Yeah.
And then you stand in the gym for an hour and you leave, and they're like, yeah, I'm not losing any weight. It's like, but you have to use the gym. They're like, oh, I didn't know that.
Right.
You know, you just didn't know.
So true. Yeah.
You had to use this, but you don't know how to use it.
Right.
That education's so critical.
It's so important. Yeah.
I'm just still so stunned that these psychiatrists and therapists didn't try something new.
Right, exactly.
Or consider the possibility that the diagnosis was
wrong. Right.
Yeah.
It was so baffling. And that's when I knew. I was like, there has to be something else. It has to be something more than just bipolar. It doesn't make sense.
I don't know if it's intuition or self-awareness. There's probably a better word for it. Is off the charts, I feel like.
Thank you.
You have an ability you're really connected to yourself. Because most people, I think, would be there not for a year and a half, but for 10 and a half years.
That's true. Yeah.
And they go, because I'm seeing a therapist and a psychiatrist. They know more than me.
Right.
But you know yourself well enough to know that you're not well enough.
Right.
And you need to get better.
Right. Yeah, no, I knew there's something else.
Now, look, this does not mean all psychiatrists and therapists are bad. We're not saying that. There are good therapists and good psychiatrists. Part of the patient's job is to find the one that works right for you.
Yep.
Yeah, it's kind of like dating.
It's so true. You have to interview your psychiatrist and therapist before you choose one.
Yes.
Like you have to. They're interviewing you, trying to get all this stuff, but you have to do the same with them.
That's
you know?
right.
So that's what I try and tell people all the time is like, if you feel that you're not working well with a psychiatrist, then you need to find a different one. And it's like trial and error. You know what I mean? Like you gotta work it out. It's not a one-time thing. I feel like people just feel like they're going to go to the doctor and they're gonna get medication, they're gonna, get help right away. And sometimes, unfortunately, that's not what happens. You have to really figure out who works best for you. And like you said, it's like dating. You have to find someone that works best with you. Yeah.
And every single doctor I've interviewed at MedCircle says, if I have a new patient who comes and starts interviewing me, even on the phone before we've met, they get excited.
Yeah.
Because they go, oh, this person's really doing it.
And
They're
it's
taking
committed.
it seriously. Yeah.
Yeah.
You're not going to offend them.
Right.
They're not going to be angry about it.
Right.
And if they are, they were the wrong therapist anyway.
Exactly.
Right. Let's talk about the point, that year and a half point. What happened where you go, you know what, this can't be right?
I was to the point where my addiction was like really high, and I knew something was off with that, and everything just clicked, and I was like, what am I doing? I'm about to, get into my career, which was dental assisting at the time. I was still raising my sisters, and I was like, what am I doing? I need to I got clean quick.
How'd you do that?
It was just like cold turkey. For me, it was really easy. I went to NA meetings and I really had that support. I had a sponsor. I don't know. For me, it was easy because I was seeing my mom. I was such a hypocrite at the time because I was like, oh, my mom sucks. Like, she's doing all these drugs and she's such a terrible person. But at the same time, I was doing the same thing in a sense. Although I was productive and I was, trying to further my life, I was still in that almost same state, I guess. And then it finally just clicked for me that like I need to stop messing around, I guess. And then so I got clean, and then for a few months I was starting to get back in the sense where I was like, something's not right again. Like I need to really focus on committing and getting healthy, and not only physically but mentally as well. So.
And then what was your next step?
So I waited a few months, and then eventually I went back to the doctor and found a different psychiatrist because I didn't like them, obviously. I was like, I'm not going back to them. They obviously didn't know what they were talking about. Went to a new psychiatrist, told her my backstory. I was diagnosed with bipolar. I feel like it's not accurate. And unfortunately, she said that it was, and we tried new medication again, just different medication from what I was already, prescribed before. And then, still I was struggling and not feeling like anything was working. So it was off and on, and it was such a pattern for me. So I went back, did like a year of treatment, and then again stopped because I was so frustrated. It was a pattern of like every other year, this is what I was doing.
Did she mention it could be borderline personality disorder? Mm-mm. So you still never even heard this term yet?
Nope, right.
At that point, aren't you thinking, well, I probably do have bipolar disorder?
Yeah. I mean, I was like, there's something up. Yeah. So I was accepting of it a little bit more until I was finally like, I don't know, I felt like I was getting better. So then I would stop taking medication. I don't know, I would like get into my head and be like, try and be as successful as possible and like determined to get my work done and get all this stuff done. And I would do really well for a while. And I don't necessarily think that was the medication. I think it was just me like really, really pushing myself and ignoring everything that was happening around me, I guess. Like I was still having outbursts and issues and now I look back and I was really in a bad state, but I was just trying my hardest just to get through it. And then eventually in 2015, I think it was, is when I finally got to the point where I was like, okay, there's something else wrong. I'm going to do my own research, and I'm going to find out what other mental health problems there are out there. And I'm going to figure out what I have myself, because obviously no one else is knowing what they're talking about, you know? So.
And you did that.
I did, yes.
And you just went online and said,
yeah.
What's not bipolar disorder?
Exactly.
Yeah.
Well, I put in all my symptoms, and then I started seeing all this borderline personality disorder stuff, and I was like, what even is that, you know? And then in 2015, I went back to the doctor, and I was like, I think I have borderline personality disorder. And then that's when they told me, yeah, you do. So they did all these tests for me, and then that's what happened.
So you go to the doctor with this self-diagnosis,
yes.
And then this time they agreed
yes.
that it was. Did you tell them that you had bipolar disorder, or previously diagnosed with bipolar
yeah,
disorder?
I told them that I said, I think I was misdiagnosed with bipolar because of this, and this. And then this is why I think I have borderline personality disorder. And then we went through all my history, what I've been through, you know, past traumas, and then what I was doing in my life at the time. And then they were like, okay, you have all of the characteristics. So, yeah.
To be treated for a disorder you don't have, while at the same time a disorder you do have goes untreated, what one word would you use to describe how that feels?
Chaotic.
It seems like it would be chaotic.
It was, yes.
I don't even know if impressive is the right word, but it's incredible to me that you even managed to live some resemblance of a life. Because we're not treating the disorder, and then we're treating something you don't have. That's hard.
It was very difficult, yeah. I was very unstable, for sure.
Are you angry about that?
No, not anymore. I think I was in the beginning of being diagnosed with BPD. I was really upset about it, because I was like, if I would have just known, I could have prevented all of this instability that I created, you know. But now that I know, I can just move forward.
Well, obviously getting the right diagnosis is part of that moving forward. In our next episode, we're going to talk to Sammy about what actually happened when she got the correct diagnosis, got the correct treatment, but still why 2017, she says, is one of the worst mental health years of her life. Thanks for watching. If you liked what you just saw, then why not subscribe? Click right here for new episodes and new series every week. And to access exclusive mental health videos that we only release at MedCircle.com, check out the links below.